Hello, AAPOR. This is David Dutwin from NORC. As of this virtual conference, your past president of AAPOR. It has been an absolute honor to serve. Starting with a little bit of a review, you'll see some of the topics that we've done research on scrolling on the right. We've done over 50 surveys in the past 2 months on COVID-19. About half of them have been in the probability-based AmeriSpeak panel. As well, we've retooled our field interviewers to do contact tracing. We're currently conducting contact tracing in Maryland and upcoming in Delaware, and also are in conversations with other states. As well, we've been able to continue some of our real essential studies, such as the National Immunization Survey and other key vital research for the federal government. A couple of examples of the COVID research include the COVID Impact Survey. This is conducted for the Data Foundation, as well as a number of other partners, the Alfred P. Sloan Foundation, the David Lucile and Packard Foundation, the Federal Reserve Bank of Minneapolis, of course, NORC, and AP. Now, this is a multi-wave survey that's going to be continuing for quite a while, conducting about 9,000 interviews each week that it's fielded. It includes AmeriSpeak panel respondents, as well as an oversample of ABS via 10 states and 8 MSAs. It's great that the data is already available on their website. You can check out the link there. And these surveys ask a wide range of metrics, from sickness symptoms, mitigation strategies, and other impact of restrictions and other metrics. Just one example, the survey asks the American people whether they've had a family member or close friend die from COVID-19. About 5% are reporting yes. That is up from the first wave, where it was at 4%, an insignificant increase nonetheless. Some other interesting facts: the survey finds a great disparity by race and ethnicity, whereas only about 4% of whites are reporting knowing a family member or close friend dying. The same is true for about 14% of African Americans. Another survey is done for the John A. Hartford Foundation and the SCAN Foundation. Now, this survey is really focused on the experiences of people aged 70 and over. Over half have reported disruptions in their healthcare because of COVID, and amazingly, 1 in 6 have actually canceled essential treatment because of the pandemic. Unsurprisingly, over or around about half of older adults are being negatively impacted in terms of getting medical advice, managing their daily living, getting support to manage their medical conditions, and staying physically active. Of course, people over 70 are doing a lot of the things other people are doing. We're watching TV more, we're connecting via friends and family over phone and video more often, and we're spending more time on our hobbies. Another survey NORC has been a part of has been the Rustin D Center for Social Sector Innovation survey. This is part of the University of Chicago. They have, this is a 6-wave study, not noted here, but I did want to point out, they did find that 40% of Americans still are not placing COVID as the most important priority for the U.S., and that there's a real substantial correlation between that and media distrust. Generally, their research focuses on income disparities. You can see a pretty strong linear trend in worry about losing one's job. And income loss already is highly skewed by income, but more so, and interestingly, it's not just persons of low income, but women of low income that are disproportionately impacted by COVID-19 with regard to their income. AARP, of course, is doing a great deal of research as well. Just to note a couple of findings, they report that the vast majority of Americans do not want to reopen the economy until we can have widespread testing. A smaller amount want to wait until there's a vaccine, and an even smaller amount want to reopen the economy right away. And though it's a small amount, you can see there's a substantial skew by party identification on that metric. Of course, as part of their mission, AARP probes about caregivers, and they find widespread support in helping caregivers, including being eligible to receive government subsidies to replace their pay during this difficult time. So that's it for me. Thank you for your time, and feel free to reach out to me if you have any questions.